All right, I'm going to call to order this meeting of the Larimer County Board of Commissioners. Today is Monday, August 12th, 2019. I'm Tom Donnelly, Chairman of the Board of Commissioners this year, joined by John Caballos, Commissioner from District 1, Steve Johnson, Commissioner from District 2, and Linda Hoffman, our County Manager, is here at the controls. We have a number of folks in the room today, as the board will conduct a work session as the Board of Social Services. So there's a number of items on the agenda, and so maybe I would defer to Heather to kick us off.
Thank you. Good morning. I'm Heather O'Hare, the Deputy Director for Human Services. Laura Walker, the Human Services Director, is out today. So I will start to my far left with introductions.
Very good. Welcome. Hi. You just make sure the light's on. You don't have to. It doesn't amplify. You just have to.
I'm Catherine Palmer. Just started with Human Services. I am the Deputy Division Manager. Sorry, it's a lot of acronyms, DDM, over Operations Division.
Very good. Well, welcome, Catherine.
Good morning. Shannon Reef, Operations Division Manager.
Hi, I'm Lisa Silcox. I'm the Aging and Adult Services Division Manager.
Laura Sarter, Benefits and Community Support Division Manager.
Anne-Marie Groverick, Business Operations Coordinator.
Carissa Clinton, I'm the new 40 Administrator over Child Support.
Vanessa Fuel, Deputy Division Manager in Benefits and Community Support Division.
Welcome.
And then we have a number of staff just
folks
listening in.
Great. Well, welcome.
Thank you. So before we dive in,
Hopefully
just
you all
wanted
want to come back.
Always.
We won't count on it, though. Okay.
before we jump into the agenda, do we have any additions?
Are there any additions, Commissioner?
Thank you, Mr. Chair. Thank you, Ms. O'Hare. I'd like to have a conversation about the recent USDA proposed rule change that has implications for Larimer County residents regarding the SNAP program.
Okay.
And we did discuss this at the State Board of Human Services meeting on Friday, so I have some insights from that discussion that I can share with folks.
Great.
Thank you.
Anything else?
No. Let's try and make it done. Get it done with that.
Okay. So with that, the first agenda item, we've talked over the last two work sessions about our restructure that we've been going through. And part of that restructure was adding our Aging and Adult Services Division. So I wanted to introduce Lisa Silcox, who is our new new division manager over that division. And that was to consolidate all of our services for aging individuals and individuals with disabilities. So Lisa will introduce herself, tell us a little bit about her background, and then just give you a quick snapshot about what she envisions for that new division.
Yeah, so in our new division, just so that everybody is aware, we have options for long-term care. We have long-term care eligibility, adult protection services, and office on aging. So I'm super excited to be part of the division. The last 4 years, I've been a nurse in the community doing long-term care, hospice, assisted living, and was able to see firsthand just how important it is to keep someone independent in their home. It is heartbreaking when someone is looking at having to move into a facility when they've been in a family home for 40, 50 years, and to be able to provide the services to keep them there and independent is absolutely amazing. So super excited to be part of everything. Before I was a nurse in the community here in Fort Collins, I was over the public health nursing at the state of Wyoming for the Wyoming Department of Health. So also got a good view on, we did a lot of home-based services, so ties right into what we're doing with our division. Moving forward with the division, I would really like to enhance our services for people who are living with dementia and Alzheimer's disease. That's a population that is rapidly growing. In fact, 1 in 3 seniors die with some sort of dementia or Alzheimer's disease, so I really feel like it's important that we have enhanced services for that population. And then I would also like to work with some of our community members, and especially our public health division, on implementing more evidence-based programs for disease prevention, health promotion. And with my background in public health, that's kind of near and dear to me as well. About 80% of our senior population are living with at least one chronic health disease that can affect their ability to be independent in the home. So that's somewhere I'd like to focus. And really, I think just all of our programs are doing such an amazing job. So just really continuing that level of service and really looking at enhancing all of our programs so that we can really prepare for the demographic shift with the increased aging population. So,
Thank you. Any questions?
Commissioner.
Thank you, Mr. Chair, and thank you, Ms. Silcox. Two questions. One is I noticed that you made reference to long-term care, and I'm wondering, is there any logic to using the term that I thought was the current term of art, which is long-term services and support? Is it just a matter of semantics, or is it a matter of syncing up with, what the state is doing and at the Fed? So that's one question.
I think they're very similar. Yeah, I think it's
So-
just a choice in wording, but and maybe the long-term care comes more from a nursing clinical background. That's
Sure.
probably why I referenced it that way.
And that's what it's called in the eligibility world as well. HCPF calls it long-term services and supports on more of the clinical side. So we have two state offices that call it something different, but it really is bridging both the long-term eligibility aspects as well as the support services for individuals both in and out of their own home.
And thank you. That's very helpful. And using two terms, depending on the context, I suppose, you don't think that confuses folks.
The process is not easy. And so that is something that Lisa's really looking at is where is there overlap or where are there gaps between the programs as we consolidate them into one division, making that the most efficient and easiest for both individuals that are our clients as well as the larger community to understand.
Great. Then my second question, although there were a few questions wrapped up in the first one, relates to what you're thinking about, Lisa, as far as moving forward. And you mentioned perhaps a different role for the county regarding issues affecting older adults, dementia, Alzheimer's, and those kinds of things. I don't think I heard you say anything about behavioral health or mental health issues as they impact older adults. Could you comment on that, please?
Oh, that would definitely be another focus because I feel like they interlap. I feel like a lot of our aging population with dementia also have the co-part of behavioral health issues as well. So that would definitely be included in our
Thank you.
focus.
And that is a very strong component of the Directors Association's strategic plan, behavioral health for children, but also specifically for the aging population and working with the new governor's task force as well.
Thank you, sir.
Okay. Any other questions? All right.
So the next agenda item, August, is Child Support Awareness Month. So we've asked Vanessa Fuel to come and give us an update and just talk about what we're doing here in Larimer, both for Awareness Month, but then also just giving us an update on the program in general.
I think it's on. Great. Yeah, thank you for having me today. And Carissa Clinton is here with me as well. She is our new 4D administrator over the child support program. So as Heather mentioned, August is Child Support Awareness Month, which is what brings us here today. And we're excited to be here to talk about the important work of the child support team. So I'll talk a little bit of give an overview of child support services. I have a short story to share about the impact of our work. I want to talk a little bit about pass-through, and then we can open it up for questions at the end. So our mission is to assure that all children receive financial and medical support from each parent. Children need the support and love of both parents, and we want to make it as easy as possible for children to have that support. Children who receive financial support from both parents do better academically. Children who have a relationship with both parents meet developmental milestones more timely. When a young child's family experiences an income increase of $250 a month, not only does it help their family now, but those children go on to earn about 17% more as an adult. Child support makes up approximately 41% of a family's income. We're truly the cornerstone to ensuring stability in the lives of children. So how do we fulfill our mission? We educate parents, we locate each parent, We establish paternity and support obligations, and then we enforce those obligations. Truly, knowledge is power when it comes to child support services. We help both parents understand procedures. We do a lot of education with both parents to ensure that they know what to expect when working with us. And by educating parents, they're both better able to exercise their rights. We want to ensure that child support orders are fair and that non-custodial parents are not burdened by a debt they cannot pay. And with that, then, that children receive regular support payments. So we recently had a scenario where we had a non-custodial parent who had a large arrears balance, over $60,000.
Wow.
And yeah, a large arrears balance.
That's a lot.
And naturally, that would create financial distress for the non-custodial parent and the children. And of course, when someone gets that far behind, it can feel so overwhelming that they don't know what they're going to do and how to do it. But that family stayed engaged with our child support worker, and he was at risk of having his professional license suspended. That's one of the mechanisms that we have. As a result of our efforts and the willingness and compromise of both parents, they were able to work it out among themselves, and the non-custodial parent, or excuse me, the custodial parent, the mother and the children, were ultimately able to be housed. And as a result of that, it wasn't necessarily by making payments to our office, right? They were able to work that out independent from our office. But as a result, the custodial parent was able to forgive that debt, and now the non-custodial parent is making regular payments and is in good standing with us. So we thought that was a great example of seeing this family that was really struggling. The custodial parent with the children who's looking to our worker for support is now able to be housed with their children.
Can I ask you a question about that?
Sure.
I've never really understood the role that you play and the role the courts play in these orders. This might be a good example to talk about. My guess is you probably work with the parents, make a recommendation to the court, and then the court probably issues the order. Is that right?
I'll ask Laura to help me out here, as I'm new to the program, new-ish to the program. So thank you for the question.
A couple of different ways. If it's an out-of-state order, then we honor that order. If it's a order that we're going to be establishing in Larimer County, then we base it on the child support guidelines based on Colorado, and then it goes to the court system, and the judge ultimately issues the court order based on our recommendation according to the child support guidelines.
So if either parent wants to make a change, would they start with you and discuss it with the caseworker, and then would you make a recommendation to the court for a modification?
Mm-hmm. Yeah, we do.
They follow that?
Yes, we can modify the orders.
You
We
can do it,
automatically.
or the court does it.
Well, what we do is we look at orders every 3 years or sooner if there's been a change in circumstances. And then ultimately, the court is the one that makes that decision. Okay. However, there are some changes that did occur on July 1st where we are doing more negotiation between the custodial parent and non-custodial parent now. And ultimately, the court still does honor the recommendation, so it's actually court ordered. But we are more, we're able to negotiate now, versus before we didn't have the custodial parent and non-custodial parent even in the same room. So the philosophy for child support has changed over the years. Instead of it being, we're going to enforce and it's very hardcore and setting people up for failure, the philosophy has shifted from, instead of being that heavy hand, we want to try to help, because if we try to help, then we see the benefits for the child or children, because the non-custodial parent is more apt to pay.
Okay.
So in the example that Vanessa shared with us, this one, is that the role that the county played, which was to, as an informal mediator or someone to help facilitate this negotiation?
So on brand new orders, we do negotiate between the custodial parent and non-custodial parent based on the guidelines, but we do try to get them together as much as we can. In this particular situation, we would not get involved in talking to the custodial parent and saying, he owes $60,000. Are you willing to accept 20? That's really for them to get involved with and to discuss. We can't really get involved in that piece according to law. So they came to that decision on their own, and then it was honored.
Okay, thank you.
Yeah, you're welcome.
Other questions? Great. Thanks. So we wanted to talk a little bit about pass-through and the impact that pass-through has had on our families. So a little bit of history. In 1975, child support enforcement was established to refund AFDC, which we now know as TANF. And a $50 pass-through was federally mandated. So when we talk about pass-through is the amount of money that is, once a non-custodial parent makes a payment, pass-through is the amount that goes to the custodial parent. So at this time, it was required that of whatever money was collected from that non-custodial parent, $50 goes to the custodial parent. So in 1996, when AFDC was replaced with TANF, that pass-through requirement was removed. And at that time, Colorado removed the $50 pass-through as well. States were given options. So some states kept the pass-through, some states reduced the amount of pass-through. Colorado chose to remove the pass-through altogether at that time.
So I don't understand any of that.
I'm going to illustrate that here. Yeah, because it's a little confusing, right? Like, who's
The
doing that?
pass-through is for families who are receiving child support but also receiving TANF benefits.
Yes, thank you.
So it's, instead of holding that money, because many, many years ago, as it was illustrated there, if somebody was on AFDC, now called Colorado Works, we kept that money and we only gave them. So if a person was on AFDC at that time and the amount was $356 a month for AFDC benefits, and the non-custodial parent paid $200 in child support every month, we would keep $150 and pass only $50 through to the custodial parent.
We talked about this when the legislation changed. I believe we talked about this. So,
Yeah.
Okay.
Yeah.
And now
Thank
the
you.
person gets all of it. Was the change?
Correct.
Right.
It doesn't hurt their AFDC benefits. Count against them.
Right.
Now TANF, yes.
Right on.
Yeah,
You got
right.
it. That's exactly where I was headed. So thank you.
So you did understand it. Apparently.
I didn't understand the slide.
Oh, okay.
Right. That was just a little historical context. So
Okay.
in 2017, Senate Bill 1512, which Commissioner Kofalis, I believe, was a sponsor of that legislation.
So it was.
Full pass-through and disregard was implemented. So disregard means that the funds are not considered income for TANF. So now, ta-da, when a non-custodial parent pays $100, $100 goes to the custodial parent. When they pay $200, $200 goes to the custodial parent. Additionally, a couple of other points to mention about the impact of pass-through. We've seen an increase in the number of cases with payments. So in 2016, it was about 38.3% of cases where there was an active payment, and now we're up to 42.2%. And the projection is that will continue to increase. Also, the average payment has gone from $132.25 per month to $184.36.
Chair.
Go ahead, John.
Vanessa, in terms of that increase from 2016 to 28, you offer it in terms of percentages. What does that increase mean in terms of actual money, dollars that went to families and children, based on that 4%, that 4% increase?
So we're seeing not only an increase in cases that actually pay,
But
an increase in the amount.
so the aggregate amount is what, a couple of $1 million or what, or 100,000?
I don't have that with me, but I can certainly
I'd be
get that to you,
curious, because that has economic impacts, and
Oh, yeah.
and it certainly helps families and what they
Yeah.
have to save or spend.
Yes, we do collect a little over 19 million a year, but that doesn't, I mean, we can separate it out and tell you the exact amount for that particular
The overall
population.
amount annually of child support collection is 19 million for
19
Laramie
million.
County.
Yes.
So this would be a subset of that, of course.
Right.
Yeah.
So is what you're saying, Laura, that child support doesn't count towards your income to receive TANF
That's
benefits?
correct.
So if you, maybe this never happens, but I mean, I would assume there's people that have high collections of child support, and they could still get potentially thousands of dollars.
No.
No.
So-
Okay.
There is at federal poverty level,
Okay.
and if they are over that amount, then they're completely ineligible. So if
Does
if they're
child support count as income?
Child support does not count as income if they're below that threshold. If they're above the threshold, then yes, it does, and then it disqualifies them.
But if you didn't work, if you didn't have any income, but you received child support, then you would still be eligible for federal.
As long as they're not over that federal poverty level, yes, they could receive both.
That never is a problem. That's never a significant amount of money.
We've had cases before, yeah, where an order's been established for $2,500 a month, and then it was a mom and one child on Colorado Works, TANF.
And so you didn't count the $2,500 a month towards income.
And we would count the $2,500 because it's over that federal poverty level, so that person would no longer be eligible.
I thought you said you didn't count it.
If it's under the federal
Their
poverty
child
level.
support payment has to fall underneath that. If it bumps them over, then it does count.
Okay. Natural class.
That makes no sense to me.
Yeah,
I don't
right.
understand what you're saying.
You count the money, and if it doesn't put you over the limit, it doesn't affect your benefit levels. But once it trips you over the threshold, then you lose your benefit.
Then it does count as income.
So it
I
can't.
think that's what they're saying.
So it does
counts in
count.
making the test.
The initial test, yes.
If it pushes you over, yes.
But it won't affect your benefits if you're under the
If
federal
it-
poverty
right.
level.
I'm sure everybody's paying at the table.
You highlight the complexity of our
Yes.
programs. Absolutely.
Okay.
Keeping track of all that.
And so, so in conclusion, it is Child Support Awareness Month. We're wearing green. We have a couple of activities that you may see or hear about. We have purchased some T-shirts for our team, and we'll be taking some pictures. And we got pins for everyone. Carissa has some pins for you today. And we're trying to do some team builders with our teams to really highlight to them the value that we place on the work that they do, and to let our teams know that we're invested in how hard they work, because they do work with families at some very trying times and trying circumstances in people's lives. So we hope that the child support program will serve the families who need it, and that children will get all of the love and support, both financially and emotionally, from both parents. That's what we do. Other questions?
Yeah, John.
Is there a way to also determine how much money we're getting from the garnishment of gambling winnings? That was, we put that in place years ago, and the idea was that if someone was up at Limited Gaming, up at one of the places, and they had winnings of $1,000 or more, I think it was, that there would be a cross-referencing, and that would be one way to get child support to the kids.
We could look into that specific amount.
Thank you.
We do recoup a significant amount from tax intercepts as well in the spring. That's another way, in addition to the day-to-day work with parents, that we do have that direct route.
But it's great that we were able to work with the family regarding this example of, having so much money in arrears, and ultimately come up with something that was beneficial to the family and the children.
Great.
I think another thing too, that's not on the presentation, so I'll make it real quick, but Larimer County applied for a grant, and it was a very small grant from the state of Colorado, but it's a grant nonetheless, around $1,500, to help us do some outreach and education regarding child support. So look forward to that in the future, in terms of once we have decided what route we're going to go with that. That's going to be some resources out there in the community.
Will that give you the benefit or the ability to conduct some of your outreach that in a way that is culturally competent, culturally sensitive?
We would like to, yes.
Okay.
Any suggestions you have, I'm sure they're open to them.
Absolutely.
All right.
You think I would have suggestions, Commissioner?
I think you'll have questions.
Yes, I do
If
think
past performance is an indicator, you'll have some questions.
you
There's
would.
8 more items on the agenda. So thanks a lot, ladies. It was great to see you. And let's move on.
So with the next agenda item, we've talked a lot about the program integrity unit over the last 2 years, really, since Shannon joined us in her role. So we're going to give you an update on what that team looks like today, and then the work that they're doing specifically with fraud and recovery.
Okay.
All right, thank you. Good morning, commissioners. First and foremost, I just want to recognize the staff that are in the room today. So we have Michelle, Nick, Evelyn, and Rita, all from the program integrity team. So they came to listen in today and to potentially answer any questions that you have if we're not able to.
Great.
Regarding their work.
Did they all go to the statewide conference that we had here in
They did,
couple
yes.
months ago? Yeah.
Yes.
Okay.
So
Had a
to
great
give you
welcome.
a bit of it's the down button, right, Emery? Perfect. All right. So program integrity is a broad range of many different things that fall into this team. So they complete fraud investigations, which are investigating areas of benefit fraud, Medicaid, food assistance, cash programs, and those types of things, and collecting money for the benefits that were incorrectly received. They also include benefit recovery. So that's collecting money for benefits that were incorrectly received. And then hearings and appeals, which allows all clients to have the right to appeal any denied benefits or a claim that was created due to an overpayment of benefits. And then recently we just added benefits training to the program integrity team. So training used to be in benefits and community support division, and now they're over in program integrity because there are so many different ties to the quality assurance team that does some case checking and then identifies trends and patterns so that we can better train our technicians to make sure that we don't have as many agency errors when we're issuing benefits. So we've done lots over the last year to better increase our performance and to provide better services to citizens in Larimer County. So we've streamlined several of our business processes and have created a new guided referral form for technicians to complete when they believe that a client may have fraudulently received benefits or may have received an overpayment that they would like the investigators to look into. We've also prioritized referrals so that we can investigate the most egregious forms of fraud first before prioritizing the other forms of fraud. And then they've also included now a bi-monthly case review process and an enhanced screening by the team. So they're really screening each and every fraud referral that comes in so that they can better triage and get to those that are the most egregious first. We've also done a team reorganization. So the quality assurance unit and training unit joined the team. However, the quality assurance unit is going to be moving out. Although they're still part of program integrity, they're going to be under a new supervisor. The fraud and recovery cases are shared more across the team, so the team has a lot more interplay between both the investigators and the recovery agents. They're working together with the hearings officer to provide better services to our citizens. And they've also set new benchmarks and performance goals to increase timeliness and quality, including a 3-month target for case investigations, and then also for claims, really working on wrapping up that claim and getting all of the repayment agreements and everything completed with the family, and wrapping that up within 3 years. Am I talking too fast? No. Do you have any questions? Okay, good. I have a tendency to speed through. Okay, so just a little bit of background. When we do an investigation for fraud, we really take that opportunity to work with families and talk to them about the complex rules and provide more education around their benefits that they've received. Most families do not purposefully try to fraud the system. It's just a misunderstanding of the complex rules and when they're supposed to report and how. So we really take that opportunity to provide client education. So the investigator meets with the client, explains the rules, and then an overpayment claim is created and the recovery agent collects on that claim, working with the family to develop a repayment plan that works for them. We also have intentional program violations, or IPVs, which is when a client intentionally has frauded the system. They've provided inaccurate information and they've done so on purpose to try to receive more benefits than they're eligible for. So when we find an intentional program violation, we will meet with the client and they can sign an IPV waiver, which basically says that they admit to it and they will no longer receive benefits for the amount of time that they're ineligible for them. So that can be up to 1 year to 3 years. Or we have to establish that IPV through a court order, meaning we have to refer that case over to the district attorney's office and they can make that court order and make them pay that back. We also have criminal prosecution. So these are also cases that we refer to the DA's office for criminal prosecution. And then an overpayment claim is created and we collect on those overpayment claims. Speaking of claims, we have 3 different types of claims. An agency error claim, which is when we have made an incorrect decision about their eligibility, and it was our fault, essentially, that that client has to repay that claim. Federal law does require that even if it is an agency error, that a client have to repay the amount of overpayment that they received. We also have a client error claim, which this is when a client has unintentionally submitted incorrect information. And then the fraud or IPV claim, which is when a client intentionally submitted incorrect information for the purpose of receiving benefits they weren't eligible for, and they may be subject to criminal charges. And lastly, this slide is really more for informational purposes. I won't read through all of the percentages, but when we recoup money from a client, we, and as Larimer County Department of Human Services, do not keep the entire amount of that claim or that payment. So we have to provide some of those funds back to the state or to the federal government who issued the benefit. So this just gives you a breakdown of if it's a client error, then we are able to keep, for instance, aid to the needy and disabled 20%. If it was a fraud or an IPV, then Larimer County was able to keep 40%. So this just provides a little bit of context about how much Larimer County is able to keep of those funds that we've recouped.
And if it's an agency error, what happens?
We pay it all back. Mm-hmm. We have to give all of that back too. We don't keep any portion of that.
Otherwise, we'd make a lot more mistakes.
Right.
No, we would not.
Some of these are 100% state or federal money, and if you get to keep some of it,
So that concludes this
some other
presentation.
county would do that.
Yes, exactly. Not Larimer County. Yes.
Could theoretically.
So that concludes the presentation. Do you have any questions specifically related to program integrity and the update?
John, go ahead.
Thank you, Mr. Chair. Thank you, Shannon. That previous slide where you showed how much the county has to reimburse, are there percentages that you can show us that the different programs, what the various rates are, whether client error or intentional violation? I'd be curious to know if it's higher or lower based on whether it's SNAP or, perhaps Medicaid. I think that would be interesting information.
So you're asking about the percent of what type of recoupment within each program?
Well, the percent of what type of, there were 3 categories of where there might be a claim established, whether it's client error, agency error, or intentional violation. And I'd be curious, for example, the first thing you listed was A&D, aid to needy and disabled. What are the breakouts in those 3 categories?
So we have actually added some of this data to the new performance report that we have on the agenda for later today to start reporting out on this more frequently. And then we do have a meeting this afternoon to pull the team together and really look at the agency error versus client error and what that data looks like. And we could certainly add the individual program to it if that's...
It seems to me that would be helpful information, for you folks in particular, because if there are patterns or some types of trends that might be helpful to see how we can address that if we need to.
So we, the way we process cases is with a generalist model. So we don't have SNAP workers versus TANF workers. They're processing a family's eligibility within all of the programs together. But it may show trends in other ways. But we can certainly add that detail.
Well, for last thing, for example, if in A&D the percent of intentional violations is 20% compared to intentional violations in another program, why would it'd be interesting to know why is that?
Absolutely, yes.
Thank you.
Any other questions?
Which area do you have the most staff errors? Medical?
I would say it's probably food assistance, but I'd need to look at the data.
Okay, interesting. All right.
Okay.
Thanks.
Great. Thank you all, and thank you all for coming.
Okay, so the next agenda item is really just to give a recap on some changes that we're making with our legislative approach. So we watch legislation very carefully because it has significant impacts for us. How we've done that is in the past is with a very small team, myself, Anne Marie, and Judy Rodriguez, and we are very involved in the Human Service Directors Association legislative process, and then we watch the bills as they come out very carefully. And so we are, because it is such a significant workload for us, we are adding additional staff to an internal team and revising our approach a little bit. So we will have point people from each of the 4 divisions that will serve to really help us engage the subject matter experts related to a bill when we need to. So if it's a HICPUF bill that's really tackling something within Medicaid, we have someone from that division that will then review the bill with staff to figure out what's the local impact, when we also have a fiscal analyst who helps us analyze the fiscal impact. And then we are also working a little bit differently with the other human and economic health departments, so that we also have input that can be provided to Commissioner Kafalis, who's currently on the HHS committee for CCI, or Laura Walker if he attends in your absence. That way we're also sending along input for the other related, whether it's a public health bill or something that impacts the workforce. So it's just trying to revise our internal process to make it a little bit more manageable when things happen so quickly during the session, but also have significant impact for many of our programs, as we've seen the last couple of years. So just more of a structural update for you.
All right, good. Sounds good.
Top of the food chain there.
Any questions on that one?
No. Good. We're excited.
Okay.
I know.
So the next agenda item is to, about twice a year, we just give you an update, a fiscal update. So Shannon's going to talk through. We're still awaiting closeout information on many of the programs. We've heard some, we're not sure if it's, we've heard updates on what closeout might look like for us, but we haven't received the finalized report yet. So this is all information prior to closeout, and Shannon will go through each of the allocations.
Thank you. So we did receive finally this morning the settlement account closeout.
Ooh, good.
So we have some exciting news to share, and that is that all of our yes, everything is green. All of our allocations we were covered, except for county admin. So I'll do that one first. So we were about 14% overspent in our county admin dollars. So we were about 900,000 overspent in the HICPUF side of county admin and 200,000 underspent in the CDHS side. So we had 700,000 over expenditures. All but 86,000 of that were covered by state closeout process. So, which includes surplus distribution. So those counties that don't use all of their county admin funds, then they can be applied to other counties who have overspent. Then in adult,
So just clarify.
Sure.
So you were overspent on admin by $80,000 then, and so that money comes out of your TANF reserves or something.
It comes out of our county-only funds. So our fund balance.
Okay, out of fund balance. Okay,
Yes.
and what is fund balance?
Fund balance.
What is the total?
Yeah, about.
We're right about 10 million.
10 million.
10 million. Okay,
Yes.
Great. Thanks.
Sure. Our adult protective services allocation was overspent by 10%. So the APS admin allocation was reduced this year by 5% for the administrative allocation. And then the client services allocation was reduced by 14%, which is why we're seeing some over expenditures. Lisa and her team have been working on different strategies for next year, as our allocation was only increased by $8,000. So we'll be working within that allocation in the upcoming year. But all of that was covered via surplus distribution from other counties who had underspent.
So how is that allocation formula set?
So it's 50% workload and 50% population.
And I think the state administers that formula. There's no committee or board.
There is. Is there? So there's a subcommittee that's out of the finance subpack.
It is not, though, similar to the WAC or the CWAC.
Yeah.
It's a county and state committee.
Yes.
Okay.
that then
And so-
proposes that
So this
to
is not
PAC.
a change in the formula, this is just a change in the caseload numbers, demographics.
Correct,
Okay.
yes.
Okay.
So our CCAP allocation, we were 94% spent because we purchased $500,000 in CCAP funds from Pueblo County. So this allowed us to be underspent in that allocation. The Colorado Works allocation, we were about 7% overspent there. We did have to use $493,000 in our TANF reserves to cover that over expenditure. And we just received an email from the state asking if we would like to take $800,000 from them to replenish our TANF reserves. So when because TANF doesn't have a closeout process, you have to use your reserves for that closeout. But if TANF funds are underspent, then the state can ask counties who are at 40% of their TANF reserve, they're not at their 40% cap, if they would like those additional funds. And our director, Laura Walker, has said yes to that.
Because we're only about half of the capped amount. That's what we have in local TANF reserves currently.
Okay.
Yes. So in child welfare, we were 5% overspent.
I'm
Yes,
sorry.
absolutely.
So then you will use 500,000 of that to supplement what you actually spent, and then the additional, you said 800,000. About 300,000 will go into your TANF reserve.
All 800,000 will go into our
all
TANF
800
reserves.
goes into okay. But you spent, but you did spend more.
We did.
And
We did.
You just spent more out of the reserve.
We did.
Okay. So you just replenished it.
backfilled it,
Okay.
yes.
Okay. Plus some. Okay.
Yes.
Okay.
So our child welfare allocation was overspent by 5%, and this was purposeful. We really work on our budget every year and plan to be overspent to maximize that allocation factor that is the expenditure allocation factor for 1920. And we anticipated that we would get covered at the closeout, and we did. We were covered fully by the closeout process. Our core service allocation was about 9% overspent, and again, this was planned so that we could maximize those funds that other counties are not spending, and we were covered fully for that during the closeout process as well. And then our Office on Aging budget was 90% spent, and the options for long-term care budget was 95% spent.
Great. Good close.
Okay.
Good questions about this, gentlemen?
Okay.
That's tough work. I mean, you bring it all in, right on the line.
That's right, yes.
Good.
Thank you.
Stressful, but good.
It is, for sure. Thank you.
Okay. So the next item is a CSTAT update. So you will see right off the bat, the CSTAT handout looks different. They have removed the red color.
Oh, yeah, that's good. So we didn't do any better. We just removed the red color.
We are still doing phenomenal.
Okay.
But they have gone with a green and gray.
Yeah, that's a flawless change. Yeah.
The
No
legend.
red. Wow.
The red is just makes everyone feel bad.
But we didn't change the legend, so.
But out of the, and they are working to revise some of the metrics. They are changing them in hopes of being more outcome focused as opposed to outputs. But the state is still working on that. So some of these data points may actually change to different measures entirely. But most likely it will still have the same format. So we have 22 total measures. And out of those 22, we met the goals for 16, which similar to most of our work sessions, we are far ahead of all of the other counties. The Big Ten only met 12 of the 22. So we continue to meet goals where many of our county peers struggle.
Okay.
So did they get rid of the food assistance payment error rate measure? Is that why it's 0? Is it gone? And then not applicable?
That one, I believe, is a reports issue.
Yes.
For the caper. They're still planning on keeping it, but they are having some issue pulling the reports for that one.
Okay.
Any other questions on?
We're looking here.
They need to change the red down below here too.
Yeah, it did not make the goal.
Legend at the bottom.
Oh, yeah, they made the red, still that red on the back.
They had to have it.
Offensive to So, the Big Ten counties meet the goal of timeliness. Oh, that's. Wait a minute. It doesn't line up on the back, does it? Timeliness of monthly
it's off a row.
contacts. Oh, that's not on the back. Never mind.
It's at the bottom of the front of ours.
Yeah, because I looked at that and then I saw that their timeliness of initial response to abuse and neglect. It looked like we were lagging the Big Ten counties, but we're actually a bit ahead. I was gonna say that would be really make us nervous if we were behind the other counties, but apparently we're not. Do you see what I'm talking about?
We are a little bit behind for assessment closure. And that one we always balance with some families.
We don't care about that.
There's actually better outcomes to take our time.
We don't care about the closure.
We don't like that
We just
either.
wanted to make
Right.
sure that the initial response, I think,
The initial response, we are.
we're doing okay.
Yes.
Okay. No, see, on the
We're
Big
just-
Ten counties, the first line, you have this timeliness of monthly contacts on
Right.
this page.
It's off
but it's
a
on
row.
the back of the other page. So I
Right.
don't have my glasses, so I can't.
Yeah,
I'm
it's off a
struggling
row.
to read it, so I thought, oh crap. But it's okay. I guess it's okay. But we all kind of struggle in the same areas, I guess.
Right.
The goals are obviously tougher to meet in some of these categories than others. Okay.
Right.
Well, great. Any questions about the CSTAT report, Commissioner? Just seen it, of course, so we may have questions. If we have questions, we'll email you about them.
Okay.
Okay?
Great.
I like the red thing.
Yeah, we missed the red. Bring the red back.
So the next agenda item, we have two performance reports for you. So we've been working for probably the last 6 months or so on revising this to change the format a little bit, but also include more meaningful data based on some of your questions in our last work sessions. So I'll go through this first one, which is the report that you're familiar with, looks the same data points, and then we'll go through the revised one
Okay.
and get feedback on that
Okay.
in hopes of doing away with this one for our November work session. So this is just monthly average caseload. So looking across food, medical, and financial assistance continue to decline a little bit with those cases. And in the new report, we will break those out because they are very different programs.
Yeah.
So we can see which of those programs is really the one that's declining.
And it's weird because some are individuals and some are households, and you're lumping them all into one
Right.
thing.
Right.
Which is kind
So
of
they are
funny.
very different.
Right, yeah, they are different.
Options for long-term care and adult protection, we continue to see a stable, in some quarters, an increase in the aging adults that we serve through those two programs. Child support, our cases are very stable, right over 7,200. And then children, youth, and families, this is the number of children served. So that one has been steadily increasing over the last year, of about 25% increase in the number of kids that we're serving through child protection. Why? So we're not really seeing a difference in the complexity of cases or the different types, but behavioral health, substance abuse, domestic violence continue to be the ones that we see the most.
Substance abuse by parents. You mean.
Substance abuse by parents, yes. And mixed with behavioral health a lot of times. Those two going together are very, those are the most difficult. These are just the visual graphs of these same numbers, just showing, again, the decrease in food, medical, and financial assistance. Child support staying steady. And then this shows the caseloads for options, adult protection, and child protection. Okay. And then just a different look at program activity. So child support collected over the quarter is about 4.8 million. Again, we're collecting over 19 million for the year as a whole, but 4.8 for this quarter. And then for child protection, 1,629 referrals received. And of those referrals that were received, 426 of those were assigned for assessment. So right about 25% of the calls we receive are then assigned and meet criteria for assessment.
What happens to the other ones?
So the other ones, it's a mix. We have some agencies in the community that provide prevention services. So some of those families where it seems like they could use additional information or additional resources, we can refer those to the other agencies. Others are, they don't meet criteria. We're either missing information or it's an allegation from years ago. The situation isn't the same.
Okay.
And then we have not had any formal complaints in the last quarter for any of the programs.
That's the first time I've
That's never happened as far as I know.
This is the first time since I've started in the last 4.5 years
Yeah.
as well.
We are still answering the phone, right?
Yes, we are.
Yeah. Yeah. I don't read the complaints about myself.
No, we've been working on our complaint process a lot and really getting the supervisors much more engaged in those families and resolving it at lower levels before it results in formal complaints. And I'm not sure why this graph doesn't. Oh, no, it is. So it's just showing that last quarter there that there weren't any formal complaints across the programs.
Oops. So that was the old way we do it.
So that's the old report. This new report, Sylvia Smith is here. She has been a phenomenal addition to our team as a senior business analyst and has been working with me to really revise this report.
Great.
So we still wanted to include program activity, but also took some data out of the ROM reports and the scorecard reports, just different reports that we get from the state that we believe are more meaningful to report on our activity.
And just for anybody who might be listening, Sylvia's actually working on her computer as we are having this meeting. She's
She's very efficient.
That's how interesting. That's how interested she is in what we're doing. That's fine. We understand. Okay. All right. That's fine.
You're doing that too. What
Well,
are you-
okay.
Capturing your
for those that are
feedback
listening,
in
someone's
real
doing that
time.
too.
Okay. Oops. Sorry.
she's
Go ahead.
actually I think
I'll
she's
let you
actually
do it.
working.
No.
Okay.
So this entire slide focuses on child protection. So this first row, again, is showing the total number of children and youth that are referred to child protection. So instead of showing the total number of referrals we receive, we're showing the number of kids that are involved in those referrals instead. So it's about just over 1,600 total referrals. That's at the family level. But what this shows is that there's 2,395 kids involved in those referrals. And then of those 957 children over the quarter were assigned for assessment. So again, right about 25% of our referrals then meet criteria and are assigned for assessment. And we're also breaking it down over a monthly basis instead of just showing you the entire quarter. Because in child protection in particular, there are some very strong seasonal changes when school's in session or not in session, where our workload looks very different throughout the year. And then, sorry.
In the new report, we don't get a trend of what's happening unless we remember, right?
Good
So
point.
you could have a trend.
We could certainly add,
But this would be the first time they
The-
report it, so they won't be able to.
well, we could show you in comparison to this point in time last year,
Okay.
if that would be,
Measure, I see.
We usually do by quarter, right?
yes.
Yeah.
It is nice to see over a year period of time how, I guess that's more than a year actually, how the trend line is. That's interesting.
We could show you the same
I like the graph.
over the year. Okay. And then these, so the bottom three rows are different outcomes that we believe show our performance in child protection. So that first one, the percent of children or youth exiting involvement who maintained in-home status, that's what we've previously called the remain home metric. It shows that of the kids that we serve in their home, what percent of those kids end up staying in the home throughout the entire life of the case.
Does that mean their own home or with relatives, or does it mean any of the above?
They stay in the original home that they were in when we became involved. So some of them could be with relatives, but they didn't have any disruption in where they were staying throughout the entire life of our case.
Okay.
And so that this is one that we perform significantly better than other counties across the state. So 90 to 91% for May and June. This was a previous CSTAT measure that they removed. The goal was 90% when it was on CSTAT, but it's no longer one that they report out on. But it's important for us because so much of our work is focused on in-home, really trying to stabilize those families and not having to rely on either kinship care or foster care unless it's absolutely necessary. The next one, percent of children, youth in out-of-home placement in a family-like setting. So this is the opposite of the CSTAT measure that reports out specifically on congregate care. So this is kinship placements and family foster homes for those kids that are placed in out-of-home. And again, one that we do very well on. We have had a spike over the last several months in our congregate care numbers that Thad and his team are diving into to better understand why.
So does that mean, so in June, for instance, 91% of the kids remained in their home, and so 9% didn't, and so 85% of that 9% was in a family-like setting.
Right.
So it's a very, very tiny percentage that was in, 15% of them were in a congregate.
It is a very small.
15% of 9%.
Yes, it is a very small number of kids in congregate care.
1%. Okay.
It is a very small number in congregate care.
Okay.
For us, though, it is creeping up
Okay.
from what we've seen in the past.
All right.
So we're researching that to understand why.
So would there be a problem with just putting numbers in there too? Is that problematic or not? Is it because it changes every month? Is it changes every month, or is that?
Well, it's also the way that it's measured, an average daily population versus there can be so much movement throughout the month that it's really looking at the average daily population across the month, but we can look at how better to show numbers.
So you're talking like 10. You're talking like 10 kids in June getting placed in, or something, right? Is that right?
In family-like settings or in
non-family, like in like group homes.
I think we're right at 12. I think we have 12
Yeah.
kids that are.
Yeah.
It's a very small number.
Small number.
Because
yeah.
so
But
many
it
of the
looks like
kids
it.
we serve
Okay.
stay with their original family.
Right. Right. Okay. Well, maybe you can't quantify, show the number. I don't know if there's a way to do that.
We have reports that show how many kids are in out-of-home placement and in congregate care.
It's like when, do you remember when we did that? We were talking about performance measures a couple weeks ago, and the health department came in and they had like numbers of, they had some kind of smoking.
Children in congregate care is on here.
What's it say?
It is.
I don't know how the state measures it, but it looks like 11.5 kids.
11.5 kids. Have a half a kid?
No, that's that daily.
It's the average daily.
Is that what you're asking? The number of children in congregate?
Well, no, it's just a small. It's just a small number. So I don't know. I guess maybe I don't care. But it's like when the health department came in and talking about a population of 30, how unsuccessful they were at getting people pregnant mothers to stop smoking, but their population they're in was only 30 or something,
right.
And so any number that didn't quit was like it made it tremendously high, and so. I don't know. Maybe it didn't matter. Maybe it's fine. I think it's okay.
I think those would be easy we could certainly look at those differently. We have reports that show the number of kids in out-of-home care. Yeah. And what setting they're in.
Well, because the important thing is that we're keeping kids in their homes and in this, like you describe it, family-like setting, and that's, right. And so there's a tiny number. I know you're concerned about every one of them, but you are doing really good work, and I just want to make sure that
Thank you.
We're able to quantify that and show that to people.
Sure. Thank you.
Anyway, okay, go ahead.
So the next slide, again, is showing the number of children in the caseload. So we have the 2,300 that are involved in a referral, and then it shows the assessments, and then those assessments that then proceed to cases. These are the number of cases, the number of children involved in those cases. So then moving on to adult protection services, the number of adults referred to APS. So in adult protection, it's almost always a one-to-one, one adult for one referral, one assessment, one case. So 553 individuals were referred to adult protection. The number of those individuals that were then assigned for assessment is 138. And then the number of services that were started for those clients is 107. So we have in this allocation, if you remember from Shannon's budget update, we have two separate allocations. One is to the for more of the administration, and then we have a separate services allocation. So that's why we wanted to report out on those separately. And then the total client service expenditures is just over $14,000 for the quarter.
Is there a way to, in that first row, number of adults referred to Adult Protective Services, to break that out as to why they were, what was the alleged abuse? Was it financial abuse? Was it?
We could show the allegation type
Yeah.
within that.
And it might be interesting to know what the setting was, whether they're at home or if they're in a facility.
The setting? Yeah, that's a good point.
Most of them are at home, but I could get that
Okay.
data.
That's a good point.
I mean, I don't want to make work for you, but if it's available, it might be interesting.
Sure, we could certainly look at that. Okay. And then again, the caseload, 175 cases in this last quarter for adult protection.
And we're all, forgive me, we're also able to break it out in terms of older adults and persons with disabilities.
Mm-hmm. Yes, we could certainly break out. It's the 18 to 70 and then the 70 and over.
That's right.
Is how, but we could show those two separate.
That's right.
Okay, and then moving on to the next program. So Office on Aging, these are all new data points for you. We didn't include any of the Office on Aging data in the last reports. So the number of visits to long-term care facilities, this is by our Ombudsman's office. When there is a concern of safety or care in a long-term care facility, our Ombudsman actually responds. Sometimes they'll go with an adult protection caseworker, but the Ombudsman is the team that's responsible for investigating more of the facility allegations. So there were 373 visits to a long-term care facility over the last quarter. We have seen those allegations grow. That team has steadily grown, certainly in the almost 5 years that I've been here, but it's also partly just because the population as a whole is growing so much that we see continued need for that team as well.
How many facilities do we have in Larimer County?
Oh, gosh.
40 some.
I was going to say it's between 40 and 50.
So you're making 373 visits. You're making 100 visits a month to 40 facilities, so you're going to every facility like three times a day?
3 times.
Well,
Isn't that right?
I think there's 40 to 50 long-term care, and then they also visit assisted living facilities as well,
Okay.
in
There's
addition,
more of those, maybe.
memory care facilities.
And folks are just visiting skilled nursing facilities, not assisted living, or?
They do assisted
They do
living as
both,
well.
yeah.
And I think that there's been an incline in visits to assisted living. A lot of the patients that they're taking are higher needs than assisted living. So
it sounds to me like you're in these facilities almost every day. Is that right?
We have 3 staff, and it is a full-time
That's a lot.
workload
That's a
for
lot
3
of
staff.
visits.
Mhm.
I mean, how often do they find? Sometimes it's screened in and screened out, right? Just like child welfare. Sometimes it's
Right.
they're
Yeah.
substantive and they're not, I suppose.
yeah, a lot of times they're screened out because of the person's right to their self-determination. So they can make their own choices. So sometimes someone will report that someone's being neglected, but they're choosing. It's a lifestyle.
So this is different than the licensing visits, isn't it? That the state would do, an audit or whatever you call it.
There are times, though, when this team then reports to licensing some of the concerns that they do find. So they do work with the state licensing team from time to time.
When I was in Florida with my parents, the place had a notebook on the table in the lobby of all the complaints or violations and how they were corrected and stuff. Do we do that?
Yes, it's a state requirement.
Is it a requirement here too? It was interesting.
Yeah.
But that must be a pretty big notebook for some of these places if they have all these.
Yeah.
Probably the only things that are screened in would be there, I assume, or only substantiated violations would be there, I assume. Okay. I'm shocked at how many of that is. Because I think probably, I've been in several of the facilities, and I think we have pretty good facilities.
Well, and I think with the
Relatively.
mandated reporting, so you have all levels of care staff who are making reports. And the training that goes into that is, even if you don't think it's abuse and maybe it could be, you need to report it. So I think the reporting has increased.
Okay.
That second row, total amount of respite care grants provided to family caregivers. So the Office on Aging provides some financial assistance to family caregivers, and that total is just over $30,000 for the last quarter. And then total expenditures delivering direct services for seniors through partner agencies. That's where a large portion of the Office on Aging funding goes, is providing that assistance through community programs. And that's $332,000 for the last quarter. And then the options for long-term care. So we've added more detail to their case information. The total assessments is that first line. So that's new assessments as well as redeterminations. So options for long-term care is responsible for going out and assessing the activities of daily living for that individual to see if they meet criteria for needing additional services in their home. So that's the total number of assessments that they've done in the last quarter is 814 for both new and ongoing. They have to do a reassessment to make sure that those services continue if they're needed. And then the overall caseload for options is 1,332. So here's where we've broken out the separate, we're still working on the Medicaid data because of an issue. Those reports aren't available anymore, so we're trying to figure out how best to get that information to break it out. But the food assistance caseloads are there, 11,706 for the last quarter. Financial assistance, which is old age pension, aid to the needy and disabled, and then TANF is 1,897. The bulk of those are TANF. That's the vast majority. And then child support, again, that is the same data point as the last 7,241 cases in child support. And then we will add the Medicaid as soon as we're able to get it.
Yeah, so can you back up one? So you had, what'd you have, 58,000
58,000.
total? So this is 20, and so it's going to be
Most of them are Medicaid.
It's going to be almost all Medicaid.
Yeah.
Okay.
And that's where we've seen the significant decline. We reported, I believe, in our February work session that we had an 8,000 caseload decline, and that was in Medicaid, is where the bulk of those were over the last year or so.
And what percentage of the Medicaid dollars are going for long-term care?
We'd have to look and see. The Medicaid data has been increasingly difficult to get because of difficulty with HCPF reports. So we could look and see if we're able to get that answer for you. Okay. And then the next slide shows the total benefits issued. So over the last quarter, it's 7.8 million in total benefits for food assistance. Total benefits for TANF is just barely over 1 million in TANF. And then it's broken out by month as well. Benefits for the Child Care Assistance Program. So the total number of applications received is 153. Again, we're still on a wait list.
So all of those kids went on the wait list?
Yes, I believe. We have received a slight increase in our allocation, but not enough to cover all of the kids on the wait list. So we have been working with the state on how best to tackle that.
So cumulative wait list. This is the total.
This is the total number of children on the wait list as of June is 206 children
206
on the wait list,
206 total.
with 791 being served in the program.
Okay. Okay. So 30% wait list, essentially. Almost 25, 30.
25, yeah, right about 25%.
Right. Okay.
And then benefits for child support, again, that's the same number, showing about 4.8 million collected in the last quarter for child support. program integrity. So this is entirely new data on this slide here. Amount recovered through benefits recoupment is $28,543 that was recouped. Recovered through federal tax intercept. So this is another program that recovers money through tax intercepts. $12,564 were recovered to pay back overpaid benefits, and then recovered through state tax intercept is another $8,000. So this is our recovery in the last quarter for the various types of recovery that Shannon and Catherine highlighted in their update. And then we had 47 appeals received to appeal either an initial determination of benefits or a claim to repay back benefits.
Okay.
And then that is
That's
the
it.
last.
A couple other questions. I know Thad isn't here, but I was looking at the child welfare caseload.
Where the heck is that? Where is that?
He is on vacation as well.
Somewhere. Can you tell us, are we done with the 700 additional caseworkers that the state said the state as a whole needed?
No.
We're in year, do we do 3 or 4 years of a 5-year
We are
plan,
in
or-
year 3, I believe, and there's been 350 added so far, so they've only added about half. There is a lot of discussion with the legislature, though, on the outcomes that are being achieved and whether they should continue to fund more.
What does that mean?
So there
Maybe
was.
if we got the number we needed, we'd have better outcomes. You've given us half the new people we need, and we don't have good outcomes. Surprise!
So
IQ dropped when John and I left the Capitol.
they're not sure if they will continue to fund additional positions. They were talking about an outcome study to see how
great.
counties have.
Waste more money on that than they will just funding the damn positions.
They've talked a lot about how counties have used those additional positions and whether it has increased performance. So we are working with the Human Service Directors Association to figure out how best to educate them, for lack of a better way to explain, on not only have we used all of those, we have over, for the number of staff that we've been given for Larimer County, it has actually cost us significantly more than the money they gave us, because our salaries are higher than the state average that they use to fund it. So we are overspending those staff, but also the additional requirements that have been added on to counties since then is still significant. So we would argue that 700 is still not sufficient, and we are doing great practice. So we're not sure if there will be additional funding for more caseworkers.
Well, that 700 was 5 or 6 years ago what we needed. The caseloads have gone up since then, so we need
Right.
more than just the 700 now.
And now red teams are required for every county. They've added significant workload requirements that aren't captured in the 2013 workload study.
How are we doing on our hiring? Have we been able to fill all those positions? Are people staying longer? Is there
So we
more
are,
turnover?
we are using every single one of those positions, and people are staying. The retention strategies that we presented on probably a year or so ago now, the bonuses and then also increasing the salaries have significantly changed the tenure of staff. We still have some turnover, but it's certainly is not at the 40% where we were a couple of years ago. And then we also have a lot of other initiatives going on. Thad has done an organizational assessment with Duke University and really looking at how can we continue to make enhancements that aren't just salary increases.
Okay. I'm good.
I just got to tell you, I really like the new performance
Yeah,
report.
it's a
I
lot.
think it's really
Thank
good.
you.
I think it's very good.
Good.
And
Thank you.
it's a much better comprehensive look at what we're really doing. I think it's great.
Thank you.
With graphs.
And I like the graphs.
You do like the graphs.
It'll take a while to get
The problem
that
is it's going to
out.
prompt more questions. So,
And more work.
all right, and more
Can you
work
break
for
that
you.
out into
Well, you haven't seen. You've only seen maybe one other time. But what'd you think? You like it?
Yes.
Okay, good. All right.
So
Other
then just the
business.
last,
Commissioner Caballos'
the SNAP update.
Yes.
So we are still working with the state to pull Larimer data. it's very difficult to isolate the data to really show what that federal change in SNAP eligibility will mean for Larimer County. And then I believe part of the request was also to then isolate by municipality, which we're almost positive we can't isolate it down to that level of detail, but we are still working with the state to pull the most accurate data we can to then figure out what is the implication for us with those federal changes.
And I want to make sure that the commissioners know what we're talking about. But,
I don't know. Yeah.
I don't know if you want to give a quick overview of the proposed USDA rule change dealing with broad-based
Categorical
eligibility.
Yeah,
and what
with
the
the-
implications are.
Yes, with the BBCCE, which is the broad-based categorical eligibility, what it would mean for all of the states or all of the counties in Colorado is every person that is between the 130 and 200% would get an additional $50 a month. And so $50 a month cash, which they are wanting to fund out of TANF. And what I heard last Thursday at SubPAC was fund out of TANF the reserves that the state of Colorado has. So the impact at this time, we're not able to find out exactly what the impact for Larimer is. They are working on the reports. This is moving through quite quickly from what we understand. And so
Because
we're
that $50, the $50 addition in cash would impact their SNAP eligibility.
Right. I mean, at this point, as I understand it, I mean, to back up a little bit, it's the USDA is determined that people who are getting broad-based categorical eligibility, they're not getting anything really substantive that contributes to why they should be doing that. So it's been suggested that there would need to be at least some type, $50 worth of services, support, cash assistance, in order to meet those criteria. But in the end, if that's not done, then potentially 30,000 or so people would be bumped off of food stamps, and that there are implications for that. So I guess we need to do further analysis. But I'm wondering, are you aware CCI or the Human Services Directors Association looking at any type of submitted comments, for the public comment period, which ends September 23rd. I think the state will be submitting a letter, and I'm wondering if we want to do that.
I think at this time they're trying to figure out what is the impact, to then figure out how best do we respond to the impact is really where it's at now.
So will we know what the impacts are prior to the close of the public comment period?
We should.
And then will you be able to inform us of what the impact is in Larimer to help determine whether the Larimer County should maybe put together a letter that could be submitted to CCI to see if we could get this in the record for expressing an opinion about this proposed rule change.
We can certainly send you an update as soon as we are aware of what the Larimer County impact will be. We can send it to you to then figure out what the next steps are.
Federal rule change?
Yes.
yes.
Is this what I've been reading? Are you referring to what I've been reading about of people losing their SNAP eligibility
Yes.
benefits? A large percentage of people potentially could lose their benefits.
Yes.
They would either lose their benefits or get the additional $50 a month. And it really was a hot topic last week, Thursday at SubPAC. And I think a lot of the counties are very concerned about what this potentially could mean. So there's definitely a lot of work behind the scenes trying to figure out how we can get the data that we need.
And Commissioner Johnson, and I think you guys know this, it has to do with people that are currently receiving SNAP benefits that are between 130% of FPL and 200.
Right.
And the reason that they're able to get some food assistance is because of the categorical eligibility. If that gets taken away, then those people will not be served, and that's where some people might not have that. And the one argument is that will contribute to, even though you're above 130% of FPL, I think in most communities that's still not enough to
It's very low.
get by.
Yeah, 130% is very low.
Well, thank
So
you.
yes, we will send you an update as soon as we have it. Anything else?
I don't think so.
Okay.
Thank you.
Thank you.
Thank you.
All right, next meeting, 3 months from now.
Yes,
Okay.
November.
Well, everybody get ready. Put it on your calendars now. Want to make sure you can come. Is there any further business to come before the board? today, Linda, this morning?
None, Commissioner,
Very
thank
good. And
you.
the board will stand adjourned. Thanks, everyone, for coming.
Thank you.
Thank you.